What if your body felt like it was constantly battling against you, leaving you exhausted, foggy-headed, and struggling with your mood? If you have lupus, you know exactly what I'm talking about. But here's the good news. There are real strategies to help you manage these challenges and improve your quality of life. Let's break it all down. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're diving into an important but often overlooked aspect of lupus, its impact on mental health. Lupus is an autoimmune disease that causes your immune system to attack healthy tissue, leading to inflammation and widespread symptoms. While most people focus on the physical symptoms like joint pain and rashes and fatigue, the mental health effects are just as challenging. Brain fog, extreme fatigue, anxiety, and depression are common with lupus, and they can make daily life feel overwhelming. If you're struggling, know that you're not alone. Today we'll cover why these symptoms happen, and more importantly, what you can do about them. Lupus doesn't just affect your joints and skin. It also impacts your brain and nervous system. Here's how. To begin with, inflammation. Lupus can cause inflammation in the brain and blood vessels, which may lead to cognitive issues, depression, and mood swings. Immune system overactivity. The immune system can mistakenly attack brain tissue, affecting memory and concentration. Also, potentially medication side effects. Some lupus medications, like steroids, can contribute to anxiety, mood changes, and sleep disturbances. Chronic fatigue. When your body is constantly fighting inflammation, it drains your energy, leading to mental exhaustion. And then there's active lupus disease. In some cases, brain fog and fatigue are not just general symptoms, but signs of active inflammation. If so, this needs to be objectively determined, meaning there should be other findings consistent with active disease, such as joint swelling, rashes, lab abnormalities, or other organ involvement. If inflammation is driving your symptoms, adjusting your lupus treatment may be necessary, and that can improve brain fog as well. If you're experiencing brain fog, fatigue, or depression, it's not just in your head. These are real symptoms that may be connected to your lupus disease activity. Fatigue is one of the most common and frustrating symptoms of lupus. It's more than just feeling tired. It's a deep, unrelenting exhaustion that doesn't improve with rest. Here are some strategies to consider when it comes to fighting lupus-related fatigue. First off, assess whether fatigue is due to active lupus. If your fatigue is persistent and worsening, your doctor may need to check for signs of disease activity. If inflammation is driving your fatigue, adjusting your lupus medications could help. You should also prioritize your sleep quality. Keep a regular sleep schedule, avoid screens and stimulants before bedtime, consider relaxation techniques like deep breathing or meditation as well. You also want to balance activity and rest. Pacing is key. Alternate between activity and rest throughout the day. Overdoing it on good days can lead to a crash. You also want to improve nutrition for energy. Focus on anti-inflammatory foods like leafy greens, fish, nuts, and berries. You want to reduce processed foods such as excess sugar and caffeine as well, which can worsen fatigue. You also want to stay hydrated. Even mild dehydration can contribute to fatigue and brain fog. So aim for at least 8 glasses of water daily. And then you should also consider supplements, such as vitamin D, B vitamins, and magnesium can also help combat fatigue. Always check with your doctor before starting new supplements. Brain fog can make it hard to concentrate, remember things, or think clearly. Many lupus patients describe it as feeling mentally stuck. Some tips to improve mental clarity. Again, first off, determine if brain fog is due to active lupus. If you have brain fog along with other lupus symptoms like joint pains, rash, or abnormal lab results, it may be due to inflammation. If so, adjusting your lupus treatment may help. Consider using memory aids. Keep a daily planner or use a smartphone app to track tasks. Set reminders for important events and medications. Break down your tasks. If a task feels overwhelming, break it into smaller steps. Focus on one thing at a time instead of multitasking. Exercise your brain. Engage in activities like puzzles, reading, or learning something new. Try mindfulness meditation to improve focus as well. And then optimize your diet for brain health as well. Omega-3 fatty acids found in fish, flax seeds, and walnuts can support brain function. Turmeric and green tea have anti-inflammatory properties that may help with cognitive function as well. And then, of course, there's managing stress. Chronic stress can worsen brain fog as well. Practice relaxation techniques like deep breathing, progressive muscle relaxation, or yoga as well. Living with lupus can be emotionally challenging. Anxiety and depression are common, but they don't have to control your life. Some mental health strategies for lupus patients to consider. Seek support. Talk to a therapist who understands chronic illnesses. Join a lupus support group, online or in person, to connect with others who understand your experience as well. Stay active. Gentle, low-impact movements like walking, yoga, or swimming release endorphins that improve mood as well. Even 10 minutes of movement a day can make a difference. And practice self-compassion. Recognize that lupus is not your fault. Allow yourself to rest when needed without guilt. And of course, again, use relaxation techniques. Deep breathing, guided imagery, and meditation can help reduce anxiety. Try progressive muscle relaxation before bed for better sleep. And then consider medication if needed. If depression or anxiety is significantly impacting your quality of life, talk to your doctor about treatment options. Some medications are safe for lupus patients and can be very effective. So when should you see a doctor? If your fatigue, brain fog, or depression is severe and affecting your daily life, don't ignore it. See your doctor. In particular, see your doctor if you're struggling to complete daily tasks, if your mood is persistently low, or you have thoughts of self-harm, if fatigue is making it impossible to function, or if you have other lupus symptoms suggesting active disease, such as joint pain, rashes, or abnormal lab tests. Managing lupus is a team effort. Your doctor can help you find the right approach to improve your symptoms. Lupus is a complex condition and its impact on mental health is real, but by making small, consistent lifestyle changes, focusing on sleep, nutrition, stress management, and mental health support, you can take control of your symptoms and improve your quality of life. If you found this helpful, please make sure to like, subscribe, and share this video with anyone who might need it. And if you're looking for expert guidance on managing lupus and optimizing your health, visit chicagoarthritis.com to learn more. See you next time, and as always, live well.